welcome to today's webinar on introducing the COVID-19 Detection and Mitigation and Confinement Facilities Training and Technical Assistance Center, which, as I say that, I know is a mouthful. We have started to use the acronym CDMCF, which is not much better, but I'm hoping over time that becomes more familiar to each of you. My name is Eric Trabert. I serve as a managing director within CNA's Institute for Public Research. CNA is the TTA provider for this work, and I'm also the project manager. I wanted to just take a moment at the outset here to thank each of you for taking time out of your busy schedules to attend today's session. I hope you'll find it useful, learn a bit more about the project, and also share your experiences during the listening session with us on what your experience has been so far in terms of working on the issue of COVID detection and mitigation and confinement settings. I am going to share my screen. Okay, so before we jump into it, just a few housekeeping items for all of you. As I noted earlier, today's webinar is being recorded. You probably saw there were a couple of different invitations for webinars that came out. We're doing one today, one tomorrow at the same time, and then one next Monday. You do not need to attend each of those. A lot of the same content will be covered. The only difference being what's discussed during the listening session part of the webinar. But we wanted to give folks sufficient opportunity to attend and participate if they want it. And for those who can't, we are recording and we'll be providing the recording of the webinars, the transcript, and the slides from today. We'll be posting those to BJA's project page. And as soon as I have the URL for that and the timeline for getting those posted, we will push that information out to you. For those who are interested, we have enabled the live captioning function as well. So if you want to use that, you can see on the bottom menu bar, there's a button for live captioning. You can click on that and then either select show subtitles or view full transcript. And hopefully that should work. If you run into any problems, please just put a message in the chat. My colleague Nandita Ravishankar is monitoring the chat, and she can try to help troubleshoot if the need arises. Speaking of the chat too, we encourage you to submit questions at any time during the presentation into the chat function. Nandita will be monitoring those. We do have some time set aside after we work through the initial part of the presentation for Q&A. So we'll be reserving those questions until that time. But please don't hesitate if something pops in your head to put it in the chat, and we'll bring it up during the Q&A part. Lastly, we do want to get your feedback on today's webinar. This is for us just a process of continuous improvement. So we'd love to get your thoughts on how this went. Was the information relevant for you? Was it useful? And we also have some questions in the feedback form about potential topics you would like to see covered in future webinars. So we'll be putting a link in the chat as well for the feedback form. Encourage you to please fill that out and submit it back to us. We'll provide a website where you can send that. And we'll also be pushing out the link for the feedback form in a follow-up email to you as well. So here's our agenda for today. We've structured the webinar really in halves. We're going to spend the first half roughly of the time just giving you a brief overview of the project. I know many folks on this call are already familiar with a lot of what we're going to talk about on the call. But we also wanted to introduce our team, which I think many of you may not be as familiar with. So who the CNA team is and how we can support you. We're then going to address the types of TTA that's available to you, the recipients, to your subrecipients, and to the field at large under this TTA center, and talk to you about how to access TTA, so how to request TTA, and our model for meeting your TTA needs. So how we're going to engage with you and provide support to you throughout the project period. We're real fortunate today to have Sarah Sullivan joining us. Sarah is the Senior Policy Advisor within the Bureau of Justice Assistance, which sits in the Office of Justice Programs at the U.S. Department of Justice. And Sarah is our lead point of contact for this contract. So Sarah, I'm going to turn it over to you for some opening remarks.
Great. Thanks so much, Eric. First, I want to thank everybody for joining today. BJA and CDC entered into this partnership last year in order to, jointly assist both recipients and the confinement facilities in order to help detection and mitigation of COVID-19 in those confinement facilities. And so we're really excited to introduce you to the CNA team that will be providing technical assistance as part of this award. CNA, one of the reasons they were selected is because they have vast expertise both in criminal justice and corrections and also in the public health space. Emergency preparedness, has done a lot of work with COVID-19 as well as other infectious diseases, and they'll talk more about what their experience is. But bringing that experience on both sides is going to be a really valuable expertise that they have to bring to this project. There's a lot of technical assistance that will be provided. Eric and team will go through that later in the webinar. And really excited to be able to get that technical assistance out to you all. I do want to acknowledge, we understand this is, 2.5, almost 3 years into the pandemic, a year into the funding, but we also know there are still needs out in the field based on our conversations with you all, based on our conversations with the corrections community. And so, we also know that there's still a need to take some time, as Eric had mentioned, to reflect and identify lessons learned to assist with future planning and discussions around how to make the good changes that have been made, how to ensure those are sustainable going forward. So I've spoken with many of you over the past year to provide some assistance already. I believe a few of you were at the webinars that we've held in June and September, but I'm really excited to now kick off this part of the project where CNA can really provide a comprehensive set of training and technical assistance to you all. So with that, I'll let Eric and the team take it away. Thanks for joining.
Okay, so let's start with a quick overview of the project. Like I said, I know many of you are familiar with this, but I wanted to just to sort of set a baseline here. This funding was authorized under the American Rescue Plan Act in 2021, in which the funding was made available through CDC's ELC cooperative agreement to support with the explicit intent of supporting COVID-19 detection and mitigation in confinement facilities. The goal of this funding is really to work with jurisdictional health departments and their correctional counterparts to establish and implement COVID-19 detection and mitigation strategies in confinement facilities, and to do it in a way that is consistent with criminal justice standards and best practices. The funding went to each of the 64 ELC recipients. I think a total of $700 million was made available. The allocation of that funding was based on a formula that looked at the incarcerated population of each of the jurisdictions, divided into the national incarcerated population. But if you see, the 64 recipients represent all 50 states, 6 localities, and then U.S. territories and freely associated states. ELC recipients can choose to enter into agreements with other state entities to distribute the funds for the purposes of COVID-19 detection and mitigation, if they wish. And the project period runs through the end of July in 2024. This graphic just gives you a quick snapshot of the amount of funding that's been obligated across the recipients as reported in the, I think this is data taken from the fourth quarter reports. So I know you just closed the 5th quarter, and we'll look to update that. But I thought it was interesting just to get a little snapshot of how the funding's been obligated up to this point. If you look at this as a clock and work your way around clockwise, that's 30%, or about 19 of the recipients have yet to obligate any of the funding received to this point. And another 22, almost 23% have obligated just 1 and 25%. So that's over 50% of recipients have reported at least obligating anywhere between 0 and 25% of the funds. So one of the ways I kind of interpret this, as Sarah was mentioning, is that there's still a good opportunity for us to work with each of you on your plans and strategies for obligating the funding and then implementing those strategies throughout the project period. The next slide here just shows an overview or breakdown of how recipients have, at least in their work plans, how they were going to divvy up the funds over the different strategy or the different activities that were allowable under the cooperative agreement. So if you remember, there were 15 activities allowable under the cooperative agreement. The first one at the top there was required of all recipients. So that was establishing and implementing diagnostic and screening testing program. The remaining 14 activities were optional. And you can see here a breakdown of how recipients were planning to use their funds. So for ongoing testing and contact tracing, almost 60% reporting using funding for that purpose or as part of their funding for that purpose. 40%, a little more, 40% for practices to improve isolation and quarantine. And then you see a smattering, really a clustering of anywhere between 20 and 30% of recipients doing various activities related to, staffing strategies, how to mitigate risk to staff based on certain strategies for staffing out your correctional facilities, visitor policies, also just strengthening preparedness and response systems. And then down at the bottom there, you notice there was an activity related to population reduction and diversion. That's the only one that kind of stood out to me. There's 5% of recipients, just 3 recipients said that they're going to use a portion of their funding for that particular activity. It doesn't mean that they're not using other sources of funding, certainly to address that. But as far as this particular funding source was concerned, just 5% were going to use this funding for that purpose. So that was a quick overview. I know, again, a lot of you have seen that before, but a quick overview of the program. Now, I wanted to take a few minutes to introduce our team, because I know you're not quite as familiar with that. I know that there's some people on this call I saw who I have had the pleasure of speaking with already and others that I haven't. And I wanted to introduce you to CNA as an organization. So as Sarah said, BJA contracted with CNA to serve as a TTA provider. CNA is a nonprofit research and analysis organization. We're based in Arlington, Virginia, and have been around since 1942. So we just celebrated this year our 80th anniversary as an organization. Our mission is pretty straightforward. We want to use scientific research and analysis to help government agencies operate more efficiently and to help leaders make better informed decisions. So the work we do is all in the public interest. And we work with government entities at the federal, state, and local level. As Sarah mentioned, in CNA's Institute for Public Research, we have a number of centers of expertise where we work. 3 of those centers are really relevant to this particular project. So we have a Center for Justice Research and Innovation. We have a Center for Public Health Preparedness and Resilience. And we have a center dedicated to doing work in vulnerable populations protection. I've been with CNA for about 20 years. It'll be my 20th anniversary next year. And I run our Center for Public Health Preparedness and Resilience. My background and training is as an epidemiologist, and I've spent pretty much my entire career at CNA working with public health agencies at all levels of government to prepare for and respond to and recover from disasters and emergencies, just like the COVID-19 pandemic. And in fact, during COVID-19, I spent a lot of time working with these agencies to develop lessons learned, reports, after action reviews. We've also had a number of our staff working on site, providing augmentation support to public health entities to help during the response with everything from setting up testing programs and vaccination programs to supporting risk messaging and healthcare surge planning. So we've done a lot during the pandemic. We've seen a lot of this, and in particular, my experience isn't just limited to COVID. Since I've been at CNA for almost 20 years, I've been intimately involved in our work around the H1N1 pandemic, the Ebola outbreak, SARS, and I think right after I joined CNA, we were doing work with the Department of Health and Human Services on the response to the initial SARS. So I had a little bit of exposure to that as well. Of importance for this type of work, CNA does run several national level training and technical assistance programs, both for BJA and for the Department of Health and Human Services. My deputy director on this project is Tammy Felix. She's a senior research scientist within our Center for Justice, Research and Innovation. And Tammy, if you're able, I was going to allow you to take a minute or two just to introduce yourself and your involvement in some of those national TTA programs.
Sure thing. Thanks, Eric. And hello, everyone. Good afternoon. I'm Tammy Felix. I'm a senior research scientist with CNA's Center for Justice, Research and Innovation. I've been with CNA for 18 years now, or a little over 18 years. And in that time, I've had the opportunity to work on a number of training and technical assistance programs sponsored by the Office of Justice Programs. I've worked on BJA's body-worn camera implementation program. I've also worked on their public safety partnerships program, and also a number of initiatives with the Office of Community-Oriented Policing Services around gathering and sharing best practices with justice agencies. About 2 or 3 years ago, we worked with the COPS office to develop a number of recommendations around advancing 21st century policing. So I had the opportunity to work with a lot of state and local law enforcement agencies through that program to kind of share best practices and promising approaches to, carrying policing into the 21st century. And currently, I'm also working with the National Institute of Corrections on a national level study to understand the impacts of COVID-19 on confinement facilities and also community corrections providers and the impacts on the operations across both of those areas. And I am very much looking forward to working with you all on this project and providing assistance to help you achieve your program goals. So thank you, and look forward to meeting you all in person.
Thanks, Tammy. Tammy's also going to serve as our lead TTA coordinator. So as we start to build out the provision of TTA support, Tammy will be coordinating that under this center. Tammy talked a lot about our work delivering national level TTA for the Bureau of Justice Assistance. We also, for the past decade, have run a national level TTA program for HHS within the Centers for Medicare and Medicaid Services. It's called the National Background Check Program. That's designed to work with states on implementing best practices to ensure the safety of residents of long-term care facilities by conducting background checks of those that work in those facilities. We have a lot of experience with this type of work, and really looking forward to kind of blending our public health expertise with our work in the justice space and the work in the vulnerable population space for this particular project. But we certainly can't do it alone. We brought some really strong partners to support us in this effort, and I wanted to talk about each of them briefly. So the American Correctional Association is one of our partners. That's the nation's largest and oldest association that's dedicated to supporting the practitioners in the fields of correction. So they maintain tremendous expertise in correctional operations and healthcare. They also are very knowledgeable about how to build multidisciplinary coalitions to champion both effective policy, but also practices, both in prisons and in jails. And really what's going to be valuable for us in this particular work is they maintain a very extensive network of subject matter experts that we're going to be able to draw on as needed to support your TTA needs. So if there's something specific that we can't necessarily cover within our core team, we have a very deep network of subject matter experts that we can draw upon to help support that. We also have brought on board as a partner in this effort the American Jail Association. So they represent over 2,500 members, jails all across the country, do a lot of work facilitating peer learning among jail administrators, and like ACA, have a very deep and extensive network of subject matter experts familiar with the jail system and the jail population that we can draw upon as needed to support our training and technical assistance needs. Then lastly, a partner of ours on this is the Correctional Leadership Association, which represents correctional administrators from all states and U.S. territories. We, like the American Jail Association and ACA, they also maintain a a large network of SMEs we'll be able to draw upon, have great insight into issues like behavioral health, program planning and training, and staffing within the correctional field. So we feel really fortunate to have these three team members as part of our unit. And I hope this gives you confidence that we really have a lot of the expertise that's going to be needed to work with you in establishing and implementing your strategies and goals for the use of this funding. So let's talk a little bit about the type of TTA support that's going to be available. I know many of you working in the public health space are probably familiar with training and technical assistance. We have what I would consider a very comprehensive suite of services that we'll be able to provide through the COVID Detection and Mitigation TTA Center. And it all starts with working with each of you one-on-one to do some custom action planning. So we're about to hit the ground running. We're going to put in the chat, hopefully, a link to some doodle polls to start scheduling some one-on-one engagements with each of you, where we can connect and better understand your vision and your work plan for using this funding, talk to you a little bit about any gaps or issues or challenges that you've been facing, and kind of do a needs assessment with you, and also a capacity assessment. And from that knowledge that we gain from working with you, develop a really sort of customized action plan that will then be able to work with you throughout the project period to see that to fruition. So that's where it all starts for us. I think we're going to start kicking off those one-on-one engagements probably first of the month of December, so just after the Thanksgiving holiday. And again, look in the chat for a link to a doodle poll. If we don't get it up there in the chat, I don't see it right now, but if we don't get it up in the chat, we'll send it out after today's webinar. And you can also reach out to us through an email that we've set up. I will discuss that on the next slide. In addition to the custom action planning, we can also work with you around things like providing guidance on how to use available funding. And that's just not guidance on what's allowable, but also guidance from what we're seeing from others recipients and what they're doing with funding that we think might be applicable to you based on what you've identified as your priorities. So kind of setting up that level of kind of peer-to-peer engagement, and that dovetails nicely into that third bullet there, which is a big part of this TTA support is connecting peers with one another to collaborate and to learn from what each other's doing. And we can do that a number of ways. We can either identify a peer that's working on an issue similar to you and connect you to them directly. We can also, and plan to also, host some learning environments where we can bring a group of folks together to discuss an issue, to learn from one another about practices that seem to be working well, so that each of you isn't on your own trying to figure this out. So we view peer-to-peer collaboration as really fundamental and essential to the work that we're going to do under this center. We will be hosting webinars like we're doing today to highlight things like best practices and lessons learned, and also to discuss other aspects of program implementation. We'll be using other mechanisms too to get that type of information out to you. So working to develop things like fact sheets and frequently asked questions, and doing workshops or focus groups, learn from what's going on in the field essentially, and figure out how we can best support your needs and get you where you want to be. On the training side, there is training available. So everything from curriculum development to actually going out and delivering training on site if you need it. We have experts in doing training in correctional facilities as well as confinement facilities. We can also develop train-the-trainer programs so that we can leave behind the ability for your sub-recipients to be able to go in and do that training at scale. We'll be developing a host of different tools in guidance and resources through the TTA Center. And not just developing those, but also providing you with access to updated guidance and tools that's being produced, external to this particular program, but that folks may want access to. And we are in the process right now of building out a project website, which will serve as a clearinghouse for all of this type of information and resources. And really is going to be designed to be a one-stop shop for you to go to if you're looking for something that you can easily find it, be it guidance, be it a toolkit or a checklist or something like that. Another big area where we see us providing support to you is in developing and tracking performance measures. So we want to be able to work with you to highlight the impact that your activities are having out in the field, and to make sure that we know what's working and what's maybe not working, so that there's an opportunity to course correct where needed, or an opportunity to really spotlight practices that seem to be working well, so we can get that information, as I said earlier, out to the broader field. I'll talk a little bit about the performance measures on the next slide too, because we think that's really important. And then lastly, as I mentioned earlier, we have a really strong team with a deep bench of subject matter experts in a variety of different areas. So it's everything from correctional operations to healthcare, as I mentioned earlier, training and curriculum development, administration, and even, as we talked about earlier, public health, epidemiology, infectious disease. So we want to make sure that you have access to these SMEs to help you in any way that you might need them, or that your subrecipients might need them. As I mentioned just a little bit ago, I wanted to drill down a bit on the area of performance measurement. As I talked about earlier, the action planning process that we're about to embark on with each of you, we see as a really good opportunity to work with you to develop relevant metrics to look at what your activities are doing, the impact they're having, and really a way to kind of continuously improve and collect data so that we're continuously improving. So we view that as a process and a step where we can help if you're struggling, or if you just want some extra guidance on what might be some relevant metrics to look at. That's an opportunity for us to work with you along that. We can also work with you just on collecting and reporting data for the requirements of the cooperative agreement. So we know that there's quarterly reporting that's going on, looking at progress being made against each of the milestones that you all identified as part of the activities. We can work with you to collect and analyze and report that data, and we are happy to do that so that CDC and BJA have an accurate picture of what's going on with the funding and what level of progress is being made. We can also identify through that where there might be issues or challenges that we need to put some extra attention to. And then lastly, one of the things that we're excited about is the opportunity to kind of look across the 64 recipients and aggregate data and look at that data to see, what are trends that we're noticing, any kind of impacts that this funding is having on the field at large. Identify gaps in data. So where are there gaps? Where are we having trouble not getting the data we need to understand the impact that the activities are having on the population? And also to help establish an evidence basis for best practices and promising practices. So moving beyond the anecdotal of this has worked really well for us to, we've implemented this practice, it's reduced transmission in our facility by a certain amount, and we have real hard data here to back up why we think this is a good practice. So a couple of different levels here on the performance measurement that I just kind of wanted to talk about and get across, or everything from working with you at an individual level to then taking kind of the broader picture of what's happening in the field based on data we're collecting in partnership with you through this program. So now we get to the point of how do you access the TTA? I've talked a little bit about what TTA is available and what we're here to support you with, but how do you access that? Well, the first way, which I've talked about, is we'll be coming out and doing outreach to each of you to support the development of the needs assessment and capacity assessment. So working with you to understand what you've identified as needs within your jurisdiction, or what are your subrecipients' needs. Also looking at the relationships that you're developing, both with your subrecipients and with confinement facilities in your jurisdictions. What are some ongoing challenges and mitigation strategies? And then really using that to develop that customized action plan, which can identify here is where we think TTA will be most valuable to you. And again, kind of look at it temporally. So maybe there are certain things that we want to focus on in the near term, and maybe there are some longer term TTA needs that will be ongoing. So that's one way to access TTA, just through those one-on-one engagements and talking with us. The other way is that we encourage you to reach out to us at any time with requests for TTA. So you can do that, your subrecipients can do that. You see there, we've established an email address. It's just bjacdmcf@cna.org. Anytime you have a question or a request for some support, feel free to email that to us. We monitor that email every day, and we'll get right back to you if we need some additional information, or if we want to set up a call to kind of flesh out what it is that you're looking for. That's going to be the primary mechanism right now for you to submit requests to us. But as I mentioned earlier, we are in the process of developing a website. And in addition to that being a clearinghouse for information, there will also be functionality in that website for you to go on, log in, and submit requests for TTA support. We'll be able to track all of that information and data. And so as soon as that website is up and running, we will be sharing that information with you, obviously, as well. So that's another avenue for you to use to request TTA support. As those requests come in, Tammy, who I mentioned earlier, will be our lead TTA coordinator. She'll be reviewing those requests in coordination with BJA and CDC, looking at, is this within the scope of cooperative agreement? Is this an appropriate fit for the center? If not, what might be other avenues for you to pursue to get answers to these questions or get the support that you need? And then also developing kind of what's the recommended way that we think this request for TTA could be met. And once we kind of go through that process, we'll then assign you a TTA coach and an analyst team to help work with you to meet those needs. And I'm going to talk a bit more about this concept and model of TTA coach and analyst team. Before I do that, though, I did want to note that this isn't a one-size-fits-all type of thing. We understand that not all TTA requests are going to look alike. They're not all going to require the same type of engagement between ourselves and you all or your subrecipients. So we've identified here just a couple of different levels by which we anticipate being able to offer you support. The first is just more informational TTA response, and this can be kind of a one-off question where you're looking for a resource, you want some more information about a certain thing. Maybe it's wastewater surveillance, or maybe it's ventilation systems in the facilities, and where can I find that? We can help answer that type of a request for you. It can be a quick call, it could be an email, but these are pretty short engagements. Could also be just connecting you with another peer site. You might have some needs that are a bit more, I'd say, intense than that, but still relatively short term in duration. So as I noted before, we have the ability to develop some training curriculum and training programs for you if you want to develop a training for your staff around appropriate distancing policies or appropriate infection control. We can develop those types of trainings, and that's more of an example of like a short-term TTA response. So in that situation, we're working with you maybe over the course of a couple of days or a couple of weeks to develop that. We might go out on site to meet with you to deliver that, or do it virtually. It's a relatively confined request, but the engagement may just be a bit longer. And then there's what we would consider more comprehensive TTA. So that might be a long-term ongoing thing where we're working with your subrecipients or with you on a particular issue over a series of weeks or months. And there we're looking at kind of a big issue that we're trying to tackle that you've identified, and it doesn't really fit into either of those other two buckets, and it requires more of an ongoing engagement. And so I just wanted to kind of get across with this slide the fact that we view TTA support as really something that's tailored to what you need. It's not going to be, our response to your request is not going to be the same It really is going to be dependent on what you're looking for. So I talked a little bit earlier about this idea of a TTA team and a coach with analysts and subject matter experts, and I just wanted to come back to that a little bit and highlight it. So this is kind of our model for delivering TTA and working with both you and subrecipients in the field on this matter. So we have identified 4 TTA coaches. So we looked at the 15 activities that were allowable under the cooperative agreement. We sort of grouped those activities into a couple of different categories and assigned a TTA coach for those. We are really fortunate. I talked earlier about our partners. We're really fortunate to have access to some of the national leaders in this area, people that have spent their whole life doing healthcare and public health work in correctional settings, or really understand that environment, the confinement facility environment. So those folks are going to be our TTA coaches. We've identified 4 people to serve in that role. I've highlighted them here on this slide. Dr. Jennifer Clark is a physician and former medical director for Rhode Island Department of Corrections, and she's going to fill the role of our correctional health SME. Dr. Kathleen Maurer is a physician and public health professional that's spent her career delivering a lot of training and technical assistance work in correctional settings. So she will fill our correctional training role. Bob Lampert is a licensed attorney, and he's a former director for the Wyoming Department of Corrections. Long career there, and he really sort of understands the operational aspect of corrections and confinement facilities. And then Wendy Kelly is also a former Deputy Attorney General and Secretary of the Arkansas Department of Corrections. And her focus, at least initially as we think it out, was our population diversion and reduction. Now, the one thing that's nice about these folks, they're all sort of cross-trained and can help out in any of these different areas. So if there's not a huge demand for support on the population diversion and reduction side, one, we can work with you to see if there might be more support there than originally thought, but 2, use Wendy's expertise in other aspects of COVID detection and mitigation. So with each of these TTA coaches, we're going to assign a team of at least 2 analysts. And the way we do this is we partner up an analyst from our Justice Research and Innovation Center, so someone who has a lot of experience working in the field of criminal justice and corrections, with an analyst that comes from our public health center. So someone that is trained in public health, oftentimes trained as an epidemiologist, has an infectious disease background, sort of knows that aspect of it. And we think kind of merging that expertise together will really help strengthen the core of the team, because we can look at different issues from various perspectives. And then add as need be, right, access to the subject matter experts that I identified before. So if there's a particular issue where we need to draw in someone that really understands that area well, we just tap those subject matter experts in that regard. So what we'll be doing for each of these TTA teams is assigning a TTA team to each of the ELC recipients. And that'll be a team that works with them not only for this original outreach and sort of needs assessment, and not only if you submit a particular request for TTA, but our plan would be to have just kind of ongoing engagement with you, to see how things are going, to see if anything's changed in your work plan, or your priorities. If you're struggling, something's popped up that you're struggling with. So we want this to be more of an ongoing, continuous engagement between these TTA teams and yourselves. So just to recap a little bit, I talked about some of the resources available. I just wanted to close with kind of a refresher. I mentioned the email address earlier. You're going to see it again on the next slide. It's I encourage you, anytime you have a question or you have a request for something, please send us an email. We'll be responsive and get you the information we need, or at least point you in the right direction for that. I just wanted to kind of foot stomp that peer-to-peer collaboration element of our TTA. We think it's so important to have peers that are working on these issues in the field, working collaboratively, so that they can share information, good practices, and really help to strengthen capacity in the field. I mentioned earlier, we're in the process now of finalizing some fact sheets and frequently asked questions that should be helpful to you to answer some baseline questions you might have around, the purpose of the program, what's allowable, that sort of thing. And also we'll be developing best practices and lessons learned reports, but also I would say, products that are more implementable in the field. So they may be things like case studies. We see something that seems like a really good practice. We might do a case study on that, a short case study, put it out to you all so that you can reference that and learn from it. The information and updates I talked about earlier on the website. We'll be maintaining just a clearinghouse of what we think is the most relevant information, not just for you all, but for the subrecipients to go to and access. We want to be doing frequent webinars or podcasts as a way to disseminate information and actually spark conversation between folks. And then lastly, the website, which I discussed. So those are some of the resources we are currently building or have already established, and others that we hope to get up and running within the next couple of weeks or months. Okay, so I have talked for a little bit. Wanted to reserve some time here for any questions that you might have for myself, for Sarah, for other members of our team. And again, I just put the website or the email, that you can use to access us, not just for these questions, but for any questions that you have going forward.
Eric, there is a question that was put in the chat to me, but before we get to that, just something I wanted to know, it could be that you don't have technical assistance needs that you've identified, but you've identified that there are confinement facilities in your jurisdiction that could benefit from some technical assistance from CNA. You can either go ahead and submit that request in on behalf of that facility, or the facility themselves can submit that request, either way. And it doesn't need to be a facility that's receiving funding from you. So CNA's task and charge is to provide technical assistance to recipients, to subrecipients, and to the corrections field at large. And so if you know or are aware of a facility in your jurisdiction that needs assistance, even if they are not eligible, even if they're not receiving funding under this award, they are still eligible to receive technical assistance. And so still feel free to either yourselves or have the facility submit in that request. So that's just one thing I wanted to know. So to the question is, if we don't have a technical assistance request, but we have a quick question, either about the funding or about CDC guidelines, would we still use the same email address? Or for quick questions like that, is there somebody else we should reach out to?
I'll answer that for our purposes. I would say use the email address. We're monitoring it every day. But it's an easy way to make sure that we have a comprehensive picture of what types of questions are coming in. And I'm afraid if they go to an individual person, we sort of lose that type of oversight. So I would say use this email address, and we will be very responsive to those types of requests. Sarah, I wanted to follow up on what you just said. So I'm glad you brought that up, right? That if someone wasn't receiving funding, they can still put in a request for TTA. And I believe, and correct me if I'm wrong here, though, that you can also request support even if for an activity, say that you hadn't written in your original work plan as a focus area of yours, but you identify in the course of engagement with your subrecipients, hey, this is an issue, they can still put in a request for us for support for those types of things as well, correct?
Yes, that's right. And also there are opportunities that we will have to connect with the confinement field at large. And so there may be technical assistance needs that arise through other communication mechanisms when the CNA team is talking to the field. And so they will do their best to keep you all informed and up to date about whatever activity is happening within your jurisdiction. Eric, if folks have questions, do you want them to just unmute or put it in the chat, or either?
Either or, I think. We have a small enough group that if you want to unmute and just fire away, please do. Don't be shy if something's on your mind and you're looking for some information. We'll do our best to answer. If not, that's fine too. You can always reach us at the email if something kind of pops in your head. an hour after we get off the webinar today.
Yeah, Eric and Sarah, I don't want to steal anyone's thunder, but I think the one thing that we didn't explicitly mention was that this is a completely free service to all of the ELC recipients. This does not come out of your grant funding. We're here to just help to make sure that you're successful.
Okay, unless anyone has anything else they wanted to talk about. In terms of next steps, as I mentioned before, any questions you have or requests for information or TTA support, please email them to us at that address right there. Please take a few minutes just to complete the webinar feedback so we can get an idea of whether this was helpful for you. Did you find kind of the virtual environment to work? Is the right material covered? And also, as I mentioned earlier, what are some topics you would want to see covered in future webinars? We're happy to tee those up and get those scheduled. We're going to publish the fact sheets and frequently asked questions pretty soon. So keep an eye out for that. We will put that out to you. We will send that out to each of you in the email that we have. One thing I wanted to mention, if there is someone that you would like to be on our distribution list that you're not sure if we currently have their email for, please send that. You can send that to us via the email address we have at the top. So whoever is your primary point of contact for this award, or someone else that is working with you in this award that you would like to be to receive that type of information.
Eric, do you also want to mention the peer group that Oklahoma had started and you guys have taken over?
Yeah, thank you for reminding me about that. I stressed a lot earlier about the importance of peer-to-peer engagement and collaboration. And actually, before we even came on board, Oklahoma Department of Health had reached out and established a healthcare peer group that meets monthly, just to talk about, what people are doing, same kind of discussion we had today, what people are doing with their funding, how they're approaching things, what issues or challenges that they might be having, so that they can brainstorm ways around those, or somebody who's encountered something similarly and has found a way around it can share their lesson learned. So if you are interested, I know there are a couple of people on this call who are already part of that peer group, but if you're not and you're interested in joining it, send me a note to the email address up above there. The group meets the first Wednesday of the month. And I believe it's from 12 noon Eastern to 1 p.m. I think I got that time right. But we are coordinating that group. So if you want to be added to the distribution list for those meetings, send us an email. We'll put you on the list. We set up agendas and then facilitate those meetings. I think they're really valuable, just informal ways, very informal ways to talk about anything that's going on, or any questions that you have that you might want to share with others.
You can also just put your email in the chat right now if you want to be added onto that group.
I mentioned publishing the fact sheets and the frequently asked questions. We're also, as I mentioned earlier, going to start initiating that recipient engagement and the needs assessment. So coming out and talking with you one-on-one, just to learn more about what you're doing, your program and your needs, and those that you're seeing of your sub-recipients. So as I mentioned, sign up in the doodle pool for times that might work for you. If we don't hear from you, expect us to reach out to you and try to get something on the calendar. We will be looking at some upcoming webinars that we can do. Again, a lot of this is just like, how can we reach out and make contact with those in the field. So some future webinars may be more targeted towards the corrections and confinement facility partners. But as I mentioned in the webinar feedback form, put any ideas you have of something, a topic that you think would be useful to cover, and we can set that up. And as Sarah mentioned, we are going to start doing some outreach to the field, to major associations in the field, and to start identifying contacts that we can conduct some more direct outreach to tell them about the program, what services are available, and how they can access it, just like we did with you all today. All right. Well, thank you all again for taking time out of your day. We'll give you a few minutes back, but we really appreciate you attending today's webinar. And again, we'll provide links for the recording, the transcript, and the slides from today. We'll get those out to you as soon as they're ready and posted. If you have any questions, again, don't hesitate to reach out and contact us. So thanks very much, and I hope you all have a good rest of your day.